and
This
uploading.
conference will now be
Sometimes
recorded.
find people getting shown on camera. Probably some people might not like that. So just make sure that your cameras are off if you don't want to appear on YouTube and become a YouTube celebrity. So good morning, everyone. My name is Dr. Bhavna Sharma. I'm a medical registrar working in the NHS. We'll be doing a OET speaking session today. So like our previous session, I'll be giving you out a cheat sheet. So what a cheat sheet means is that I'm going to give you crutches that you can use in order to attempt your OET speaking in your future. So remember, on the OET speaking, you have to have certain criteria which need to be satisfied in order to pass your OET speaking. You can be the best doctor or the best nurse with the best medical knowledge, but if you do not fulfill the OET speaking criteria, you're not going to pass. So what I do in my sessions that I do on cheat sheets is that I give out sentences, or I give out a format that you can apply to each and every OET speaking that you do from now on. Now, all of these formats are not something which are final. If you want to modify them or you want to add your own English to them, then you may do so. But if you use the format the same as I provide, then you should be able to pass the OET speaking in terms of both the linguistic criteria and the clinical communication criteria. So that's the purpose of these OET speaking sessions, just to give you, just to make your life a little easier and your speaking a little structured. We give out formats. Okay, so moving on, the first thing that I want to go through is there's some people who are having problems with sound. So please make sure that your mics are unplugged, because sometimes you cannot hear anything if your mics are not plugged. Okay, all right. So starting this session, the problem that we had with the mocks that we conducted this week was that a lot of people were struggling with their introduction. Now, remember, when you are scored on the OET speaking, there are specific criteria for introducing yourself to the patient or relationship formation. So, your patient is in front of you and you're in front of that patient. Now, the interlocutor may not look like that patient. So remember, it might be someone who's very, very unwell, someone who might be quite old on your scenario, or they might be someone who is actually not even the patient, they're the patient's relative. So the interlocutor is quite different from what your scenario is. So introducing yourself and trying to confirm the identity of your interlocutor is necessary to start your OET speaking correctly. Now, what I want everyone to do is I want you to type in the chat window as to when you begin your OET speaking, how would you introduce yourself? We'll go through the common errors that people are making and we'll try and improve everybody's introduction through this session. Now, your question is that you are a doctor now or a nurse. You are in a clinic. You have a new patient. Now, I want everyone to type in the chat window as to how they would begin their OET speaking in this scenario. I also want people to tell me if they've attempted the OET speaking before and did they use this the sentence that they've written in their actual OET speaking test, and then we'll try and find out what mistakes people are making. Okay, so lots of answers are coming in. Hema has said that she would say, hello, good morning. Hesby has said he would say, hi, good afternoon. And he said, I am doctor, how can I help you? Harmik has said, hello, gentlemen, myself, Dr. XYZ, and I am your GP for today. May I confirm your details? Nimish has said, hello, good morning, gentlemen. I am Dr. Nimish Tonda. I am the GP working in this clinic. So lots of things that we can change here. Guys, I would not suggest that you use terms like good morning or good afternoon, because remember, sometimes your speaking scenarios might be quite dismal. So you might have someone who's come in with an advanced cancer, or there might be someone whose relative might be dying, or this might be a patient who's had a medical error and they're very angry with you. So if you begin these scenarios by saying good morning, good evening, good afternoon, you're going to sound very unsympathetic, or you might sound like a person who's got no empathy. So starting your conversation with hello is better. Um, Harmik, you've said myself, Dr. XYZ. So remember, myself isn't an English sentence. It's more of a local dialect that Indian English has modified itself to be. So you should write, hello, my name is Dr. XYZ, or I am Dr. XYZ, rather than myself, Dr. XYZ. This is a very common mistake that we've seen in the mocks that we've conducted this week and in the past few weeks, that people often introduce themselves as myself. This is wrong English, so make sure you don't do that. Um, some people have written good morning, gentlemen. So gentlemen, calling someone gentleman to their face is a bit awkward and not a part of regular English. So you can say good morning, hello, good morning, and that's it. Don't address your patient by anything. Because if you say things like good morning, gentlemen, good morning, lady, it sounds a bit strange. And guys, please make sure that you don't call the patient ma'am, because remember, even though you think that this is your examiner, treat them like your patient. So it would be just good morning. I'm sorry, not even good morning. Hello, my name is, and that's it. So no good mornings. Ali has said he would write what brings you here. So Ali, I would be very, very careful about this statement, because often you have your patient in a hospital and they're a inpatient. If you use terms like what brings you here, that's going to get you in a lot of trouble. So make sure that you use what brings you here only only if you're in a clinic and this patient has come to you. So if you have someone who you're going on a home visit to and you ask them what brings you here, that might also sound very awkward. Okay. So some common mistakes that I've seen, but let's just try and see how we give out our cheat sheet in order to introduce ourselves. So what I advise everyone to do is, at the point that you've got time, to just read your task and go through your notes, you identify a few things. The first thing, where are you right now? So you need to verify whether you're in a hospital ward, whether you're in a clinic, whether you're doing a home visit, because then your introduction becomes different for each scenario. What is your professional role? So lots of people wrote in our example is that I am the GP today. Guys, you weren't really told that you are a GP. I've seen people that they give their mock test and they are a medical registrar, or they're a person who works in a hospital, and then they've told me that I am the GP today. Okay, so make sure that you know what your professional role is. If you still don't understand what is the difference between a hospital doctor and a GP, you can go to our YouTube video and you can go through what medical roles are in a are present, um, which might be given in your OET speaking. So you can go to our YouTube channel and go through what different professional roles are seen on the OET speaking or the OET writing. You need to ask, who is your patient? Who is the person sitting in front of you? Uh, are they the actual patient? Because lots of times, especially in our mock test, if we give an example that this person has come in because their daughter is unwell, or they are the main carer of this patient and they want an update, and then the person in front of me asks me, if I'm playing the interlocutor, they might ask me as to how are you feeling right now, or how is your health, or can I confirm your date of birth. So remember, you need to understand that the person in front of you might not be the patient. It can get very, very confusing, guys, especially when you're nervous. You might start asking the person in front of you about their health, but they might not be the person whose health that you need to be concerned with. Have you met them before? Is this a patient that's been in your ward for quite some time and they're getting discharged? Is this a new patient who's come to your GP practice today? Or is this a regular patient that you know who's come in for a follow-up after you've seen them a few days before? So you need to understand all of these things in order to introduce yourself and get an introduction from your patient or your interlocutor properly. Okay, so these are a few examples as to how you can start introducing yourself. Hello, my name is doctor, or my name is nurse, whatever the nurse's name is. I am the dash working in this clinic. Okay, working in this clinic, or working in this ward, or working in this hospital, depending upon where you are. Notice that on my first and second sentences, in the first one, I have written I am the dash, and in the second sentence, it is I am a dash. Now, I want everyone to tell me, where would I use the term I am the dash, and where would I use the term I am a dash? Excellent. So
If you
lots of
see,
good answers.
can I?
Guys, if you want to answer, please type in on the chat window, because then the sound becomes problematic. Okay. So Aruna has said that she would use a doctor or a nurse, and they would use the for the consultant, the medical registrar, the GP. So if you're looking for specific people who are working in the ward, for example, if there's only one person working in the ward who's going to be the chief medical registrar, or the medical registrar, or the consultant, who are going to be quite specific people, and they'll be limited in numbers. I am the lead nurse, I am the nurse in charge. So if there's one particular person in that setting who's going to have that designation, then you're going to write, I am the consultant working in this clinic. Or if you want to say that I'm a doctor or a nurse working in this clinic. Okay. So lots of variations. So you can use either my name is or I am, and then you may write I am a doctor working in this clinic, and or I am the GP in this clinic. Guys, please make sure that your sounds are off. All right, moving on. Now you have to ask for your patient's details. Okay. Now I find it to be a very awkward situation when we're doing our mocks or we're seeing a speaking session being conducted, and then a person just abruptly asks, what's your name and date of birth? So they might introduce themselves as, I am Dr. Bhavna. What's your name and date of birth? So that's a bit awkward to do, and it sounds a little rude. So I've tried to change that sentence as to how you would ask your patient's details. In that case, I would say, remember, everyone, that the commas that I've put are not grammatical. They're the pauses that we will have in our speech as well. So it would be, before we begin, and then you take a pause. I just need to confirm your details. Could I please confirm your name and date of birth, please? Okay. Another option, which I like quite a lot. Before we start today's discussion, and then you take a pause, I would need to confirm your details. Would it be possible for me to confirm your relative's name and date of birth, please? Please also let me know how can I address you. So you can do that, especially where the person in front of you and your patient are two separate people. You can say, before we start today's discussion, I would need to confirm your relative's details, or I would need to confirm your details. Would it be possible for me to confirm your relative's name and date of birth, please? Notice as to how I've asked the relative's name rather than the person in front of me's date of birth, because it gets very, imagine if you're in a clinic and you get a mother who's got a child who's unwell, and then she's come to you in your pediatrics clinic with a sick child, and then you ask the mother about their date of birth. It doesn't really make any sense. So on the OET speaking also, you confirm your relative's name and date of birth, because you are going to be speaking to the person in front of you. So you have to ask them, please also let me know how can I address you? Okay. Then another option that we can do, just before we start our discussion, I need to confirm your details as a routine procedure. You are Sarah. What is your date of birth, so I can match it to the one that I have on my notes? So this is an excellent line that you can use for people that you already know. So in this situation, you're telling them that you already know them, but you're just confirming their date of birth because you're just trying to match it to your medical notes. So an excellent method of dealing with patients that you already know or that might have come to your clinic before. Guys, you can take a screenshot of this and you can use this on your OET speaking, a very good method of trying and doing your speaking scenarios, especially introducing yourself. SP, I've read your question. We'll try and discuss it at the end of this session. So guys, if you've understood the concept as to how we have to modify our statement if the interlocutor is different from the patient, or the interlocutor is someone that you already know, or someone who's admitted under you or has been with you for a long time, just type in yes and make sure that you take a screenshot, and then we can move on. Excellent. So these are some points which make people fail their speaking. And for people who are experienced doctors and nurses, I find it very unfair that they fail the speaking test because of these simple mistakes. So just make sure that you don't make these mistakes in the future. Now what you have to do is you found out the patient's detail. You've told them what your name is, and then you thank them for introducing themselves to you and thank them for coming to your hospital. So you write thank you. For example, if the patient tells you that my name is Sarah, then you can say thank you, Sarah, I will be looking after you today. So that is something that you can do if this patient has come to you for a consultation or has come to you for a visit, or you've gone to their home for a home visit in case of nurses. Then if the patient has come to you with lots of questions, or they've come to you with a new diagnosis, you can say, thank you, Sarah. I will try and solve any queries you might have during our discussion. Or if the patient is quite angry with you, or there's someone who's non-compliant with your treatment, or is someone who is a difficult patient, you can write, thank you, Sarah. I will do my best to deal with your concerns as much as I can during our discussion. Guys, when you're talking, make sure that you're speaking to your interlocutor in a way that you would speak in real life. Sometimes when people memorize these statements, they become very mechanical. You need to intonate your speaking in order to sound like a sincere doctor. So you say, or a nurse. So thank you, Sarah. I will do my best to deal with your concerns as much as I can during your discussion, rather than just going flat, rather than saying, thank you, Sarah, I will do my best to deal with your concerns as soon as possible. So instead of being flat, you need to intonate your voice to sound like a more sympathetic or an empathetic doctor or a nurse. Okay, now you introduce them your topic. You say, I will be speaking to you regarding, and then you can add whatever you're supposed to discuss, your test results, your impending discharge, your new medications, your new diagnosis. Or you can say, we are here to discuss your test results, your impending discharge, your new medications, or your new diagnosis. So notice as to how this is in the future, because you're going to be speaking to them in the future. You will say that I will be speaking to you regarding your test results. But in the second line, we're using present tense because you're already here. So we are here to discuss your test results or your impending discharge. Now, there might be a situation where the patient comes to you with concerns. Then you have to modify your tense. You have to say the problems you have been having with your diabetes, okay? Because they have been having problems, the problems have been going on and they're still going on. The problems that the patient has with diabetes have been there in the past and they're still there, and that's why you're here to discuss them. That's why your tense is going to be the problems, because it is a particular set of problems that they've been having, which might be a diabetic foot, diabetic retinopathy. So the patient is going to have specific problems, and that's why it's the problems you have been having with your diabetes. Okay, so notice how we modify the tense. This is very important on your OET speaking because they are looking for this. They are looking for you to make this mistake so that they can fail you. So we're trying to make our life easier by anticipating what our scenarios might be. Now you can modify all of this for the problems you have been having with your mood, or the problems that you have been having with your medications. So instead of with your diabetes, you cut the diabetes and you can add whatever your scenario is. Okay. Another example is, for example, a medical error has been made and the patient knows about this medical error. In that case, you're talking about a particular medical error, so it would be the incident with your medications, because it's a particular incident which took place, so that's why it's the incident with your medications. Now there might be a scenario when the patient doesn't know about this incident and you're going to introduce the incidents to them, so that in that case it would be an incident with your medications. Notice how the changes for an. The is when the patient already knows, and an is when the patient doesn't know. Okay. Guys, this is a very important point. If you've understood it, please type in yes, and then we can move on. Otherwise, I'll try and explain it again. Okay. Now, we end our introduction by inviting the patient that if you're describing something, then you tell them before starting. In case you have any questions during our discussion, please feel free to stop me and ask. Okay, so Vijay has asked how to start the conversation if it is a known patient. So Vijay, in the sentence that I gave you, in the sentence that I gave you in the beginning, you first introduce. So what Vijay has asked is to how to start the conversation if it is a known patient. So you'll use your first introduction. Hello, my name is Dr. Whatever. I am your role working in this hospital. Okay. So in every time when we go to a patient, you always introduce yourself as if they don't know your name. Even if I have a patient in my ward that I already know, so Vijay, when you already, even if you already know a patient, they might not remember your names. Don't assume that they know your name. So you still introduce yourself in the same manner. Even when we're doing our ward rounds every day, the consultant introduces themselves to the patient every time that they go and see this patient, because they cannot assume that the patient remembers their name. So Vijay, you say, hello, my name is Dr. Vijay. I am the medical registrar working in this ward. Or if you want to still add something, hello, let me reintroduce myself. My name is Dr. Vijay. I am the medical registrar working in the hospital. So you can just add in a line after hello. Let me reintroduce myself. Okay, Vijay, you can do that. If you're happy with that answer, then you write that so Vijay has said, good question. We have done the examination in the roll card. How to speak then? I would advise Vijay, if you've done the examination, you still start with an introduction. You say, let me reintroduce myself. My name is Dr. Vijay. I did an examination on you earlier. We're now going to discuss your test results, or we're now going to discuss your examination findings. If you've got someone who you've examined, some people like to do this. You might ask your interlocutor when you have the 3 minutes. You can ask the interlocutor as to what their name is or how they introduce themselves. And then you can say that, hello, let me reintroduce myself. My name is Dr. Vijay. I'm a medical registrar working in this hospital. We've done your examination now, and now we're going to discuss your examination findings. Imran has said, in introduction, we say to the patient that how may I help you? However, we're already given most of his information. So when should we mention that we know about you given in our case notes? So what you can do is when you've introduced yourself as to, hello, my name is Imran. I'm the medical doctor working in this clinic. Um, Before we begin, I just need to confirm your details from my notes. Or just before we start our discussion, I need to confirm your details as a routine procedure so that I can match it to my notes. Um, I can see from my notes that I will be speaking to you regarding your test results. So Imran, you can do that. You can refer back to your case notes. You can say that I can see from my case notes, I will be speaking to you regarding your test results. So I can see from my notes can be added, and that might make the conversation more natural. So Imran, if you've understood that, please type in yes, and that then we can move on. Excellent. We're going to move on now as to this was our introduction as to how we should do a good introduction in our OET speaking. Guys, remember on your OET speaking, you are being judged on specific criteria. If you do a good introduction, which is grammatically correct and is in a polite manner, you're already halfway through. Even if your conversation after this goes downhill, remember this is an English exam. This is not a medical exam. Even if your conversation is completely medically wrong now, but you've still given that good introduction, you should be able to score good marks. So keep an eye out on the introduction as to how to introduce yourself. It's going to create a good impression on the examiners, and scoring marks will become easier. Now we're going to do, how do we explain medical terms to a patient or a patient's relative? Really important. In the mocks that we conducted and in majority of OET speaking sessions that I take, I find that most mistakes are made either in introduction or in explaining medical terms. You need to understand that the person in front of you is not medically trained. Okay, there might be a scenario where you might have a nurse in front of you, you might have another doctor or another nurse in front of you. So that might change, but in most of the scenarios, the person who's sitting in front of you isn't medically trained. So if you're going to use a lot of medical terms which are quite difficult to understand, your patient isn't going to be able to make sense of this discussion, and they might interrupt you and ask you about basic things that you've mentioned. For example, if you tell them that you've had a myocardial infarction, the patient might ask you, doctor, I don't really understand what is a myocardial infarction. So that's a very bad sign. Okay, if that happens, your examiner is going to cut down your marks for your clinical communication as well as on your medical English, because you did not use proper English to describe the medical term. So be very careful as to never mention medical terms which a layperson cannot understand. Let's try and explain this by examples. For example, very common case and something which is very basic for us doctors or nurses. If you want to describe to a patient that you want to give their medications intravenously, now the patient might not understand what intravenously means. In that case, when you're talking to them about some medical terms, you write, we would need to give your medications intravenously. Intravenously, in non-medical words, means through one of your veins. Another example, we need to tell this patient that we need to give their medication subcutaneously. So the patient won't really know what subcutaneously means. So when we're speaking, we would say, we would need to give your medication subcutaneously. What that means in simpler terms is through the upper layer of the skin. Another example, we would need to perform an appendicectomy. An appendicectomy, an operation to remove your appendix. The appendix, so they might not even understand an appendix. So you can describe that by saying the appendix is a tiny part of your gut. Notice as to how I've said gut and not intestine, which can get sometimes infected or swollen. So even though you've said some medical terms, immediately before the patient interrupted you, you have told the patient what that means in non-medical terms. And how you do that? You say the word intravenously in non-medical words or non-medical terms means through one of your veins. What that means in simpler terms is through the upper layer of the skin. Okay, so yes, Dr. Zana, you can do that. You can say that so when you're speaking to someone and you're explaining something is, for example, if you're telling someone that they've had a heart attack, you might say as to, you've had something that the doctors call a myocardial infarction. Myocardial infarction is also known as a heart attack. Okay, so you can say the medical term and then you can say the meaning of it. Dr. Zana, if you have a patient who's had a diagnosis of, for example, multiple sclerosis or something which is quite complicated, you still have to tell them that you have multiple sclerosis. So you say, you have been diagnosed with multiple sclerosis. So you tell them the full medical term and then you talk about what that means. Okay, then you have to describe that in lay terms. I would advise you to practice this in your common scenarios, explaining things like what an appendix is, what a pancreas is, what a liver is, what kidneys might be, what a kidney stone is. All of these do pop up quite a lot on your OET speaking, and they expect you to be able to explain it in non-medical terms. Okay, now let's try and make a task. Okay, what I want you to do is tell me that, or if I'm the patient, you tell me that I've had a heart attack, and you have to tell me what a heart attack is in layman terms. So let's see how people bring up their answers. You're going to tell me that I've had a myocardial infarction. How would you explain it in non-medical terms? So what I want everyone to do is in non-medical terms, I want full sentences, Faisal. I want full sentences as to if a patient is in front of you in your OET speaking and they're asking you, doctor, what's a myocardial infarction? How would you explain this to the patient in front of you? So I really like Aruna's answer. She's written, you have been diagnosed with myocardial infarction. So Aruna, you should say you have been diagnosed with a myocardial infarction, because you can have multiple myocardial infarctions. So using the term a needs to be done. It is also known as a heart attack. What that means in simpler terms is that the blood supply to your heart is compromised. So very good answer, Aruna. Atik has said, you have been diagnosed with a myocardial infarction. It is also known as heart attack. So you should say it is also known as a heart attack, because you can have multiple heart attacks. That's why it's a single heart attack. So you're right, it is also known as a heart attack. What that means in simpler terms is that the blood supply is reduced, which in simple terms, so I think you should write simpler terms, the blood flowing into, not to your heart, into your heart, because it's within the heart, has either decreased or stopped to a certain part of the heart. That's fine. Percy has said, in simpler terms, myocardial infarction means that your heart is not getting enough oxygen, which is compromising its blood pumping ability. Very good answer. eBay has said, I would like to let you know that you have a condition where there is a shutdown to the flow of blood to your heart. So that's fine. Charlotte has said, you have been diagnosed with a condition called myocardial infarction, which means heart attack in simple terms, or I can explain that the muscle of the heart is deprived from the blood supply, which caused severe pain. You should write which caused the severe pain, Charlotte, because we're pointing to a specific episode of severe pain that the patient had, and that's why it should be which caused the severe pain. So Faisal has said that he would say, it is sorry to say that you have had a heart attack, which actually means the working ability of your heart is significantly reduced. Faisal, I think there's a typing error. You should write, I'm sorry to say that you have had a heart attack. So I'm sorry, not it is sorry. Okay, so very good answers. So good answer, Hema. She said, from your history and clinical examination, it seems you have got a myocardial infarction. What that means in simpler terms is, so Hema, it should be a heart attack where the blood and oxygen supply to your heart is reduced. So very good examples. Now let's try and make that a little difficult. I want you to explain to me in layman terms what pancreas is. So you have to tell me, how would you tell a patient? Patient has asked a nurse or doctor, what is pancreas? So SP has said he would write, it is an organ on our body. So SP, on our body, means it's present on the top of our body. It's not on our body, it's in our body, because it's inside our body. When you write, its function is to regulate glucose level in our body or sugar level. So very good answer, except it should just be in our body. So Chandar has said it's an organ in our body that produces insulin and other hormones. So Chandar, if you go to SP's answer, he's written its function is to regulate glucose level. So remember, the patients might not understand what insulin means. So use simple terms as much as possible. So Munawar has written pancreas is one of the organs. So Munawar, it should be organs because it's not a single organ. We've got multiple organs in the body. So one of the organs. So whenever you write one of the, it's followed by plural. One of the ladies, one of the people, one of the plates, one of the glasses. So it's always a plural after one of the present inside our tummy, mainly responsible for regulating. So instead of our sugars, you should write the sugars in our body through a hormone called insulin, not through hormone called insulin, through a hormone, because there's a particular hormone. That's why you write a. Okay. Very good answers, but some simple mistakes that we can change. Titi has said pancreas is an organ in your body. So Titi, that sounds a bit strange. You shouldn't say your body, you should say in our body. Okay, because everyone has a pancreas. Okay, so you don't say your body, you should say our body. Okay, the patient isn't abnormal that they've got a pancreas, it's a normal thing, and that's why you include them in your description. So you say in our body, which helps in digestion of food. So very good examples. Just some mistakes about one of the organs. So lots of people have made the same mistake as to one of the organs and not organ. If you've made that mistake, I've had at least 10 people who've made that mistake. It is one of the organs. Saida has given a very good way of writing this, of saying this. She said, I appreciate your question. Let me explain to you. Pancreas is an organ which helps in digestion of food and produces insulin, which regulates blood sugar in our body. So Saira, very well done. Very good answer. So now we've understood that the OET speaking is going to ask us to explain a number of layman terms, and that is one of the main points that they're testing you on as to how you're able to form good sentences and you're able to explain medical terms nicely to the people in front of you in proper medical English. All right, so just some common examples which do appear intravenously through one of your veins. MRI, an advanced scan which uses magnetic technology. Notice that in intravenously, I've said through one of your veins because the medications are going to be given to the patient's veins. So it's your veins, but then if you're describing organs, then you say in our body. So that's the difference between using your veins and our body. So remember, you have to differentiate these two things. Malignant is often asked, so you write a type of, or you say a type of cancer which can spread to other parts of the body very fast. Then sepsis comes a lot, then you can say a medical emergency when the body gets overwhelmed by an infection. The body subsequently develops abnormal blood pressure or heart rate, which needs immediate treatment. So these terms do come up quite often, and it's useful to have explanations ready. Some previous examination on the OET had people who had to describe radiotherapy. So you can write, you can say radiotherapy means a medical treatment because it's one of the medical treatments that you have. Similar to an X-ray to treat common cancers. Then it can be Laparoscopy is a type of operation where a small hole is created in a specific area of your tummy. In the specific area, you could write, because it's a specific area that the patient is concerned about, or myocardial infarction, which we've already discussed. So these things do have appeared in our previous OET exam. So it's useful to have a layman terms ready for this. Okay. So moving on, in our last session, people asked us what's the difference between sympathy and empathy. So this is a very good picture which shows you the difference. So in the first case, it's a person whose bear has lost his arm, and the person in front of him is saying, "That's so bad that this happened to you." Now in the second case, the person is empathetic. So they're trying to fix the teddy bear's arm, and their expression is also sad. So what sympathy means is recognizing that somebody is sad, and what empathy means is being a part of somebody's sadness and trying to help them out as much as you can. So that's the basic difference between sympathy and empathy. In sympathy, you're an observer of a patient. You're observing someone and you're recognizing that someone is sad, or someone is happy, or someone is tearful, or someone is anxious. But in empathetic, you are an active participant in their sadness. So you're going to help them with that sadness, and you're feeling sad that they're feeling sad. So you're a part of their emotions. So um, it's quite important, if you want to be a good doctor or a good nurse, instead of being sympathetic, you need to be empathetic. So that's a small thing that we need to understand. We'll see how we've applied this concept to be empathetic in our next difficult patient. So now we're going to be dealing with one difficult scenario which comes quite a lot on your OET speaking exams, which is your non-compliant patient. I think lots of people would have had this case. If you've given the OET speaking before, it's very, very common to have this scenario on your OET speaking. So let's try and make a cheat sheet for a non-compliant patient. So this is an example of how this scenario might appear. So the scenario is that you're talking to a 76-year-old gentleman who has been recently started on insulin for type 2 diabetes. He has been very nervous with self-administration of medications. Therefore, he has been non-compliant with his medications. You have been assigned by the doctor to teach this patient regarding administering insulin. On arrival, you find this patient refusing to take insulin. And your task is explain to the patient why he needs insulin, explain in detail the procedure of insulin injections, reassure the patient he would be able to self-manage his insulin injections, emphasize proper procedure to prevent complications. So there are two parts of this scenario. If you try and break it down, one part is that you have to deal with a non-compliant patient. You're supposed to tell them that you should take your insulin. The insulin is good for you, and you shouldn't be nervous about the insulin. And the second part is that you're supposed to explain the actual procedure of injection of insulin. So in one part, they're going to test you on your empathy, and they're going to test you on your clinical communication as to how you deal with a non-compliant patient. And in the second part, they're going to test you whether you're able to use layman terms when you're describing a medical procedure of giving insulin injections, including you have to explain what antiseptic procedures is, how do you administer subcutaneous injections, what subcutaneous injection means, and what sites of injection you can use. So every OET speaking scenario is sort of broken up like that. As to one, they're going to test you about empathy and sympathy. Second part is going to be basically explaining medical things, and that's basically being able to use layman terms. So the way that I would approach this scenario, so Dr. Munawar has said he is an old gentleman. Can I address him as sir? So Dr. Munawar, you can do that. Sometimes in England, we use sir quite a lot, but the problem is that this test is actually based in Australia. So in Australia, using terms like sir might be quite awkward. I know in Eastern countries and in the UK, sir is very commonly used. But in some countries, especially like like Australia and the US, we don't really use the term sir for older people. So I would try and avoid that. I know it's a bit awkward where you have someone who's much older than you and you have to address them by their first name, but it's something that we have to do. They might tell you about their name being Mr. Jonathan Smith, and then you can refer to them as Mr. Smith. That might be a little more polite. But if you've asked them and they said that you can call me John, then you have to call them John. You're going to say, John, I'm going to speak to you about your insulin. So it depends on how the patient needs to be addressed at. Um, so Naveen has actually said that he works in Australia and some people take it as offensive. So again, it's a very cultural thing. In the UK, using the sir is very common, but in some countries, they might find it to be offensive. Some people, they use the term dear quite a lot. So they say, okay, dear, that's fine, dear, I'm so sorry, dear. So this term is actually quite well known in the UK and it's quite commonly used in the UK because that's the way that the people in UK talk. But in Australia or in the US or even in India, it might sound quite awkward to refer to someone as dear because it's quite an endearing term. It's quite a, it's it signifies a lot of closeness in a relationship to use dear. So I would try and advise that. So Vijay has asked, what if no name is given in the roll card and he mentions that he's your old patient? So Vijay, if no name is given during the time that you're preparing, you can ask your interlocutor as to what the patient's name is. Okay, so then you can say that you are Mr. Jonathan Smith. How can I address you, sir? Or how, not sir, you can say, how can I address you today? All right. Okay, so moving on. I always give the 4E or the 5E strategy when you're dealing with a non-compliant patient. Now, this starts with empathizing with your patient. Now, in the example, the patient was someone who was very nervous about the insulin injections, and the scenario said that the patient is very nervous with their medications. So the first sentence that you say is an empathy sentence. I can understand that you might feel very nervous with these medications. A lot of patients sometimes find it, so it should be sometimes rather than sometime, sometimes find it very nerve-wracking to take this medication, or they might find it very difficult to take this medication. It's completely understandable. Several patients often complain that they feel very nervous when they are asked to take this medication regularly. It's very common and understandable. So in the first sentence, you're telling the patient, it's okay that you're nervous. A lot of people feel nervous, okay? Or if the patient is someone who finds it very boring to take medications 5 times a day, or they might find it very tiring or very frustrating to take the medication, then you can say that I can understand you might feel very frustrated with this medication. Several patients often complain that they feel very frustrated when they're asked to take this medication regularly. So in these sentences, you just introduce your patient's sentiment. So nervous, frustrated, angry, tired, bored. So all of the emotions are inserted in this sentence. And then you're in this way empathizing with your patient. Now that you've done that, Yes, Dr. Manawar has said overwhelmed. So that's also quite common, especially when you've got someone who is on insulin injections 3 times a day, or they are on Parkinson's medications 5 times a day. So it's a lot of medications to take. Or for example, they've been given a heart medication, they've been given antiplatelets, and they have to take it for a year. So the patient might get very tired of taking all of these medications. So you can say that I can understand you might feel very overwhelmed with this medication. So these are the emotions that the patient has, and you have to empathize with the patient's emotions. Then you emphasize the need for medication. Now, you've told the patient, okay, I know you feel very nervous when you take this medication. I know you feel very overwhelmed when you take this medication. It's completely understandable. Then you emphasize that they do need to take these medications. And how do you do that? You say, that being said, it's extremely important that we ensure that you're able to take these medications. However, despite the difficulties, it is imperative that this medication is taken regularly. I can understand that you feel this way. However, it is paramount that we make a plan for you to be able to take these medications regularly. So notice how in all of these sentences, I've never said you take these medications. Okay. In the first sentence, I said it's important that we, so we means you and the patient, ensure, so both of us are going to ensure that the patient is able to take these medications. Do you understand the difference between the tone? If I would have said, that being said, it's important that you take your medications, and now I've said, that being said, it's extremely important that we ensure that you're able to take these medications. Do you understand the difference in between saying that you need to take your medications and we ensure that you're able to take these medications? Just type in yes if you understand the difference. Okay, very good. Um, so Vijay has asked, can we use the term however? So in this case, because we're talking about a patient's difficulties and then we're using the term however, it doesn't really count as for very, very formal English. And because it's speaking and it's a common speaking term, you should be able to use this. Okay. Now you've done your empathy. You then emphasize the use of medications, and then you explain why they need to take these medications. You can use these sample terms. This medication has been proven to be extremely effective in alleviating symptoms similar to yours. This medication is recommended by various medical councils as the gold standard treatment in people with your diagnosis. This medication is the first line treatment for diabetes. That means it is the best available treatment currently and is used in majority of patients with excellent results. Now you can use all of these lines in each and every medication scenario. So that's your cheat sheet. You can take a screenshot of this and you can use this in each and every scenario because I've made generic terms. You don't even need to modify them. If there's a patient who's not taking his medications, if you use this line, then that should be enough. Remember, this is an English exam. This is not a medical exam. So using generic answers like these should be fine. You don't need to explain how insulin works. You don't need to explain how insulin is the best medication because of the side effects and things. Uh, or you're not supposed to explain what the insulin does to your kidney, to your bones, or to your gut. If you just explain this simple thing that this is the gold standard treatment and it's the most effective treatment in people with your diagnosis, that should be fine. You're going to score marks in English. Now you've explained why this medication was very important. Now your last point is you empower the patient. What is that? You've given this patient a lecture that you aren't taking your medication because you are feeling nervous. You need to take the medication. This medication is very good. You have sort of given this patient a lecture. Now you give the power back to the patient. You give the patient back their power and you tell them, I know you're finding it difficult. Please be reassured that our priority is your health. In order for you to start feeling better, please do these medications. I understand the situation completely. Please do remember that our priority is to make sure you are healthy. Therefore, I would request you to please start taking these medications. You've empowered the patient to make the decision themselves, but you've told them that you're going to make sure that they're healthy, and in order for them to be healthy, they need to take their medications. So that's how you give the patient their power back. So do you understand why it's important to give the power back to the patient? Because you've given them a lecture. Just type in yes if you've understood, and then we can move on. Excellent. Now, because we've understood the concept of empathy, sympathy, and empowering our patients, we have become better doctors and better nurses. Even though we are preparing for an English exam, we're preparing clinical communication. And my purpose of doing these lectures as a doctor is to teach you in order to how to take better care of your patients. Okay. I know you're very concentrated on doing this English exam, but the purpose of this English exam is to see if you're going to be a good doctor or a good nurse. So by using these concepts of empathy and empowering the patient, you're on your way to becoming better doctors and better nurses. So everyone who typed in yes, you've improved your medical practice today because you've understood as to how the patient is our priority. And that was all while learning for an English test. So very good. Well done, everyone. Now, the end of any compliance or non-compliant patient, you end by saying that you inquire. Is there anything I can do to help you take your medications? Is there anything which might help you with complying with these medications? Is there anything that I could do or answer which might help you take your medications? And the patient might say, no, doctor, that's all right. And that's the end. That's your patient satisfied, and now they're going to take their medications from now on. So that was our 5E strategy, which was empathize, emphasize, explain why, empower the patient, and inquire. So that was one difficult scenario which comes a lot in your OET speaking. I hope everyone's learned something new today. and they're going to go back and practice all of these techniques in their future OET speaking. Just make sure that we're going you enroll for the workshop tomorrow, which is going to be a drill workshop by Mr. Manoj on active and passive voice. So that should be quite useful, especially if you're attempting your OET writing. So SP, can you type in your question again, because I seem to have lost it. If you type in your question in the chat window, I can answer it now. But guys, if you want to check out, all of these sessions are uploaded on our YouTube channel. It's called Teacher Academy. And you can visit our website, www.teacheracademy.com, to get further information by the courses and the speaking mocks that we offer. If you have any questions, guys, can you please type them, because my time is set to British Standard Time. So Imran, I can't really see the time according to 3:49. So if you type in your questions, it would be quite helpful. Otherwise, I'll be available tomorrow as well before Mr. Manoj starts. Then I can answer your questions then as well. And if any SP has asked, if the patient is not coming in clinic, but his children or siblings came for prescriptions, SP, just remember that your scenario should include that the patient has given his permission for the children to come in for prescriptions, because with any medical council, you're not allowed to give children or siblings a patient's prescription. So make sure the scenario includes that. If they haven't come in clinic, then you can say that we're here. I can see from my notes that you're here to collect your relatives' prescriptions. Okay. So guys, just make sure that you know that the teacher discount group is also open. In case you want to book in your OET exam, we're accepting bookings up till December. If you just text Dr. Prashant on the number provided, you can join in the discount group. It saves you about 25% to 30% on your OET fee. So it might help you a lot with your OET preparation, just to save some money. But again, thanks everyone for joining. If you're interested in joining tomorrow's session, please text Dr. Prashant on the number provided, and then we can send you the GoToMeeting link. It's going to be at the same time as today. If Imran, you've got any questions which were left, you can come in and ask the questions tomorrow as well, and I'm happy to answer them. It's just that because of all the answers that I've had, I've lost most of the questions. So thanks again, guys, for joining, and I hope you learned something new today, and I hope that's going to improve your speaking in the future. Good luck, everyone.